Okay guys, wish me luck. I'm getting ready to go back to get my port implanted. Um, and then I'll be out. Should only be an hour, and I will come back with my magical port. So it will go into the upper part of my right chest, and then they're going to put the catheter into my right jugular vein and down into like right above my heart, and then we'll be all set and no more IVs. It's a power port, so I won't have to like when I get contrast for MRIs or CTs, I won't have to get an IV. It can go directly into the port, and basically everything can go into the port now. I can do my blood tests through the port, and I basically don't have to get stuck in my veins anymore. Yay! So it's nice, especially after being bruised for the last 4 months from getting IVs for my fluids. So we are getting ready to go back soon and get this done. Good morning, everyone. So it is the day after I got my port implanted. I brushed my teeth last night and I had some bleeding out of the top of this incision here. And then this morning after I got dressed, I had some bleeding out of the bottom of this top incision here. So fun times, fun times. I have Ehlers-Danlos syndrome, so I am prone to poor wound healing. I have issues healing after every surgery that I've had. My last surgery, I had some active bleeding out of my surgical cut for a few days. And the surgery before that, I had a hysterectomy, and I had my cervix and uterus removed, and the cuff, they call it the vaginal cuff, where they sew up where your cervix was. At about 7 weeks, that actually ended up having wound dehiscence. The skin in the incision site died, and it ended up breaking open, and it took like 4 months to heal. My first surgery was a cholecystectomy, so I had my gallbladder removed, and my surgeon had made the comment at that time, "You're a really slow healer. You're taking about twice as long as all my other patients." And at that time, I didn't know I had Ehlers-Danlos syndrome, which we call EDS. So then when I went in for my hysterectomy, I didn't think anything about it, and we had that big wound dehiscence. And then my third surgery was I had Tarlov cysts, which are cysts on your nerve roots. It's kind of like an aneurysm on your nerve root. The side of the nerve root balloons out, it weakens, it stretches, it balloons out, it fills with cerebral spinal fluid, CSF fluid, and then it puts pressure on that nerve and the nerves above and below it. Well, more particularly the nerve roots. It is very painful. I still have incredible pain to this day from that. So anyways, back to the port. As you can see, it's pretty bruised up, pretty good. It hurts pretty good. I'm not gonna lie, it definitely hurts pretty good. I went into this, they told me that they were gonna give me sedation. I was gonna have twilight, and then when I got there, I was awake through the whole procedure, which was really mind-numbing. I really did not like that. It was my biggest fear going into this, that I was going to have pain and I was going to be awake. I don't like to be awake for procedures. I don't think anybody likes doing this stuff, but if I can go in, sleep it off, and come out when it's all over, I'm definitely a lot happier about it. So make sure you talk to your anesthesiologist, and they do offer general anesthesia, so you can definitely go completely under. I have had twilight many times. I have only been awake through it one time, so I did not think that's what was going to happen. But that's what happened. So I was pretty numb most of the day yesterday from the lidocaine. I really did not have to recover in the PACU because they didn't really give me any anesthesia. I read the surgical notes. It was 1 milligram of Versed and 100 micrograms of fentanyl. I had my blood pressure got very high during the surgery, and they had to give me some more medication. So that's where we're at. I did not get anything after this surgery. They told me we don't give anything after this surgery. So it definitely hurts. I get medications from my other problems, or I should say I get a muscle relaxer and a pain med. But still, I take my pain meds every 8 hours. I took them 4 hours ago, and I'm hurting again. So that's where we're at with this. If this is something that you want to talk to your doctor about before you go in, I'm going to call my surgeon today and see if they can give me something. So that's where we're at. And I wish you the best of luck if you're going through this, or you have a friend going through this, or a family member. Mine is not for chemo. I have something called POTS, which is postural orthostatic tachycardia syndrome. It's part of my EDS. It's a comorbidity. And basically, I get low and high blood pressure. I have very fast heart rate. I get dizzy. I pass out. And I can't catch my breath when I go up a flight of stairs. So basically, when I go from laying to sitting or sitting to standing, my heart rate can spike as much as 100 beats per minute. So I can literally go from like 80 beats per minute to 180 beats per minute in just a matter of a few seconds. My blood pressure can either drop or get very high. I drink tons of water, or as much as I can, but I have gastroparesis, which is a partial paralyzation of my stomach muscles. So I cannot drink or eat that much food at a time, or I get sick, which kind of is the complete opposite of what you need when you need to be hydrated. So I drink as much as I can, and I get two bags of IV saline, 1 liter, every 4 days. So I go on Monday and Friday. I get a liter of saline each time, and that helps me control my heart rate and my blood pressure. I was actually able to come off of my beta blocker for my heart rate and my clonidine for my blood pressure, because it would get very high because I would be very dehydrated. I wound up in the ER multiple times due to severe dehydration, once by an ambulance, because all of my muscles literally froze. I could not, or paralyzed. I could not move any of my muscles. So that was scary and definitely not that fun. And after 3 trips to the ER, costing my insurance almost $10,000 each time, they decided that it was okay for me to get the IV saline bags. So that's it. You can see it. It's bruised all the way down. It's pretty gnarly. And I'll check in with you guys later today or tomorrow. All right. Take care, guys.